What if I told you that there's a device that costs less than lunch for four at Chick-fil-A that could help prevent deadly falls, but most nursing homes refuse to use it? I'm David Terry, and as a nursing home abuse and neglect attorney, I've seen too many nursing home residents who have broken their hips, broken other bones, suffered brain damage, or even died in falls that might have been prevented if nursing homes would just use personal safety alarm. So personal safety alarms are simple devices designed to alert staff when a resident tries to get up alone. There are several types of alarm, but let's just talk about two of them. So bed alarms use weight-sensitive pads placed under the resident when she's in bed. And when she gets up, the alarm goes off, giving notice to the nursing home employees that she's getting up and putting herself into a potentially dangerous situation. Now, chair alarms work pretty much the same way. They're placed on a wheelchair or a regular chair, and it detects when somebody starts to stand up, and it gives notice to the facility. So here's what these devices actually do. They give staff members the time to intervene before a fall happens. So think about it. So many nursing home falls occur when residents try to get to the bathroom alone, or when they're confused and they attempt to walk without assistance. Personal safety alarms are especially critical for residents with dementia, or balance problems, or those who are on medications that affect their judgment. These residents don't often remember that they need help, but an alarm ensures that the staff members know the moment that resident begins to move. So for families, personal safety alarms provide a little bit of comfort, knowing that when their loved one is not immediately being supervised, that somebody will or should respond immediately if their loved one needs help. Personal safety alarms can create a safety net during times when their loved one's not being immediately supervised, and families get comfort from that. So the pushback that I get in depositions of nursing home employees is that safety alarms or personal alarms don't prevent falls, and technically that's true. There's nothing on a personal safety alarm that's going to grab the resident and hold them in bed or in the chair until an employee comes. But that's missing the point. If a resident gets out of bed and is trying to walk to the bathroom, it may take them a minute or two to get there. They don't run, they're not fast. And in that time period, an employee can get into the room and help prevent them from falling, but only if they have notice. And the personal safety alarm provides that notice. So why don't nursing homes use them? That's what we're going to explore in our next video. And the reasons might shock you. Spoiler alert, it's really not about resident safety.